That, I think, is an area that's very promising, and we're still learning. I think it's somewhat in its infancy. Most of the studies that have been done with bispecifics have targeted B cells, CD20 and CD3 on T cells to bring them together. In Hodgkin, clearly we want to utilize a target on the malignant cells such as CD30, and we still have to really work out whether we want to engage T cells or we want to engage NK cells and monocytes or macrophages. So to date, the bispecific antibody with the most data is the AFM13 antibody, which targets CD30 and CD16. CD16 is typically on NK cells and monocytes. But there was some original data that was kind of a little disappointing as a single agent. There was some very promising data in combination with immune checkpoint blockade, but it was difficult to know which of the two agents had contributed to those high response rates. But the data that was recently presented at the AACR meeting, which was very interesting, was to take cord blood NK cells and preload them with AFM13. In other words, now the NK cells are infused into the patient already with the bispecific antibody attached, so that all they need to do is to stick to the tumor cells. And those results in a small study were really pretty incredible. So I think we need to obviously have a larger study and longer follow-up to see if that's going to be as good as expected. But certainly that was a very encouraging and promising kind of result.